Right.
Okay, so these are the Fox questions. He's asking, what is the capacity of our facilities with
Sure.
relation to the COVID-19?
So the capacity has always been an issue, and we are still very concerned, especially if we don't flatten that curve. We do anticipate a surge. So we're going through several different scenarios on how we could actually improve the capacity. One of the key things we're doing right now is trying to what we call cohort our patients. So we're taking certain wings of certain hospitals and making those the areas, those wings, to be more for patients that may be either a person, what we call person of interest, that we don't know if they have it, and if they definitely have it too. So we're trying to block off or section off certain areas of our hospital to do that. Right now, our capacity is okay, so I feel okay, but I'm not sure. I'm still nervous. A week from now, we may not have enough capacity. So we're still looking at other alternatives of how do we utilize wings that we have not used before. Again, our surgery centers and operating rooms, we're looking at all the different options we have, because although we're reasonable at capacity today, I really am worried we won't be in a week.
Okay. And then what is the status of gear and equipment supply?
That's actually a big worry for us. The biggest issue for us right now, supply-wise, is the face mask, that N95 masks. We're already at a critical level right now. We're going to get some more in the next couple of days, but we're very, very concerned about that. So cohorting allows us to reuse those masks. So we are trying very innovative ways of trying to, when can we reuse and not reuse, not put our caregivers at risk or the patients at risk. But that's a very big concern. And that's also part of the reason we actually have consolidated a lot of our outpatient offices. We've closed a lot of offices and consolidated them so that we don't need to have to use masks at all of our sites. So we're doing anything we can to really, really conserve those masks for the people that need them the most. But I'm very concerned about that.
Okay, and so are there more units and devices on order?
They're on order, but as you know, they're very hard to find, and even for hospitals, there's a lot of price gouging. So it's a tough situation. So a lot on back order. So it's not like I don't anticipate we're going to get all the needs met in the next few days at all.
How will staff be protected? How are they being protected?
That's our primary biggest concern, obviously, is that we have thousands of staff at all our hospitals, and we would absolutely need to make sure that they don't get sick taking care of others. So that's where we're trying to be really judicious in who has to wear this protective devices and who doesn't, trying to consolidate, again, to certain units, certain areas. We're doing our best to make sure that the staff have all the equipment they need so that the last thing we want is the caregiver, when they're trying to help others, themselves get sick.
So will community expect to handle patients from out-of-county hospitals?
So yeah, it is going to be challenging because a lot of these rural critical care hospitals, critical access hospitals, don't have the ICU capabilities and they don't have the ventilators. So I would anticipate that all of our surrounding hospitals, not just community, but all the big hospital centers, will need to be able to accommodate facilities that cannot handle, again, the surge. A lot of critical access hospitals may not have any ICU beds, or if they do, they only have 1 or 2 ventilators. So we do anticipate that, and I again am nervous about that because it's just going to be challenging how we do that. So all the hospitals in town are trying to work together on how do we actually have access to all our bed controls to see where these patients go.
Okay. And talk about the training for staff that's been taking place.
Yes, we've been doing extended. Now, for that, we have been preparing for a while, so that is nothing new. So part of this whole preparedness that we've been working on for several weeks, we've annually, the staff get training on how to wear masks and how to utilize them, gowning and defrocking. We've accelerated that. We've also provided videos for our staff, and we have education specialists that are out there as well to make sure that the staff get educated on how to use the protective equipment. We just on COVID-19 regularly. And then just to obviously, since there's so much information, we're sending out information on a daily basis. So not to overwhelm the staff, but once a day and every afternoon, we're sending out communication on what you need to know for the next 24 hours in terms of taking care of our COVID-19 patients.
And people are being very innovative too, aren't they?
Absolutely, absolutely. Like I said, we're doing things we have never done before. And so even, again, how to use masks and how can you keep a mask on and see several patients? What can you actually keep and not keep on? We're being very innovative. And as I mentioned before, even for ventilators, we're being very careful on how to decide who needs a ventilator. We have what's called BiPAP and CPAP machines, so one can use those as opposed to ventilators. And again, even more really esoteric things of using 1 ventilator for 2 patients. So you really have to become innovative in these times of crisis, especially when there's critical issues with supplies.
Okay. He's asking, what is the occupancy rate of current ICU isolation units?
We're above 90%, and we are actually already getting pretty full. And we've got to remember also, it is influenza season as well. So we still have a lot of sick patients that don't have COVID-19 that are also very sick. And we still have patients having heart attacks and strokes. So we still have a lot of influx of patients that are coming in, not just related to COVID-19. So we're really at a pretty high capacity right now.
Can you talk about how we interact with MESH, the health departments?
Absolutely. And they've been meeting, if not daily, pretty close to daily on how we interact and work together. MESH has been critical with this, as well as the Indiana Patient Safety Coalition. And we've been working together on, again, how to share information, how to share beds, and even things about how do you decide which patients need to get intubated or on a ventilator and so on. So we're really trying to share as much information as possible.
Okay, a lot of questions here. What do internal community stats and predictors indicate of potential influx of patients and a timetable?
That's really hard to predict. So what we do is we have a dashboard that we're looking at every day of our current assessment of where we are with beds and physicians and nurses and so on. We are trying to prepare for the worst, but honestly, I can't tell you what that worst is going to look like, though.
Okay. I think some of this has kind of been answered. How long will a seriously ill patient occupy a bed in facilities, and will that impact the ability of treating patients who may not become seriously ill until later in the outbreak?
The biggest issue for that actually is going to be testing. So there's going to be a lot of patients that are moderate to seriously ill, but if we know they don't have COVID-19, we may be able to discharge them or transfer them to a different bed sooner. Some of the tests may take up to 4 days to get back, so that's probably the biggest issue about that. For patients that are very sick, they can end up staying in a critical care bed for up to 10 days or 2 weeks at times.
He says there's been an issue in Italy and Washington State regarding hospital decon and cleaning.
Yes.
Any concerns around that?
Yes, our EVS and cleaning is a big deal. So because once you have a COVID patient, you actually have to wait a couple hours. There's something called droplets. You need to let all the droplets in the room settle down before you can clean the room. So you have to wait for that, then actually the cleaning of the room. So the turnaround time for cleaning the rooms is a significant concern. We ramped up the staff, but there's just but the waiting that we need to do for cleaning the rooms is a concern for us.
Okay. So those are all his questions.
Okay.